Hello, I am Dr. Rajasekhar Mysore from Chirag Global Hospitals at BTM second stage, Bangalore. Anorectal abscess. Abscess is collection of pus. So when pus is collected in any particular area, we call it as an abscess. Anorectal region, if it collects, we call it the anorectal abscess. The commonest place where the anorectal abscess happens, starts, is what we call as, there are something called anal glands which are situated in the intersphincteric area or under the mucosal, under the lining membrane. So there are glands, they get infected due to various reasons, and then pus will form. When pus forms, we call it an anorectal abscess. So how do you know the patient has got anorectal abscess? Because in that area when pus collects, you have a lot of pain. The patient can't sit, throbbing pain they will have. And if it becomes too big, then they will start developing fever, chills and all that. So these are some of the symptoms of anorectal abscess. So now, once an anorectal abscess happens, what will happen? It starts spreading and body tries to bring it out. So it will make some holes, it bursts open, pus starts pouring out. Then we call it as a fistula. So if it is there for long times, it will form like tubes and all that. And then we call it as tracts. So there will be an opening internally, opening outside, and pus will be forming in between, and that forms fistula. If abscess is not treated at proper time, it will become fistulas. And what is the treatment options? Whenever there is an abscess, in the very beginning, within 24 hours, if there is a mild infection in the anal glands, they may respond to antibiotic, but most of them, they will not go to doctors or think it as an anorectal infection. They think it is some piles, and they start taking some home remedies, and by the time they go to doctor after 3 or 4 days, it is already late. So it may not respond to antibiotic. Most of them won't respond to antibiotic. They all require surgically, which has to be drained. So abscess has to be drained. So there are different approaches in draining. If it is not drained properly, again they will become to fistulas because whole pus has not come out. A little will come out, little will again remain there. So it has to be an adequate drainage. We call it adequate drainage. That means whole abscess cavity has to be opened properly and cleared properly. And it should what we call a dependent drainage. When we have opened the abscess, when the patient is sitting or lying down, through the opening, pus should be able to come out regularly. Otherwise, it will again collect there in some other place and it will form fistulas, or abscess starts spreading inside deeper and all that, or wider. So all perianal abscesses should be drained as early as possible and should be drained properly. There are different gadgets we use. So we may use RF, we may use diathermy, we may use lasers to open that. That doesn't matter. Proper drainage is very, very important, and as early as possible. Don't try to postpone that. Even when they go to doctors, some of the doctors will advise you wait for 2-3 days and see whether it will respond. It won't. And once abscess has formed, drain it as early as possible. And meet how to drain. You have to meet a surgeon or a proctologist or a colorectal surgeon, and don't go to any other medical divisions because they are not going to help. So you have to go to a surgical branch, preferably a proctologist or a general surgeon who will be able to do the job well.